I'm Deepu Sethi. I'm a specialist knee surgeon and I treat people with any problem related to the knee. I see a wide range of people from teenagers to older people. The most common reason people come and see me is due to pain they're getting in their knee, and very often they may not be able to pinpoint when this started or how it started, but they get pain and this may be associated with stiffness and swelling, and it's just not getting better, so they come and see me. The other group of patients who come and see me is people who've injured their knee, and this may be a fairly significant injury on the football pitch, on the ski slopes, or it may be something more trivial, such as their knee started to hurt or swell up after squatting down on the floor to pick something up, or twisting on their knee. In these cases, they may have done some damage to the knee, torn a cartilage or torn a ligament. And the last group of patients who often come and see me are people who have instability in their knee is giving way on them. And this may be a result of some historic trauma in the past, which they'd forgotten about, or it may be something that developmentally they're just having problems with more often than not, their kneecap coming out of place. The key with all these conditions is to get a proper assessment and proper diagnosis, and that's where I can certainly help. And often on seeing a patient, I'd do a thorough assessment by asking them some questions about the problems they're having and by examining their knee. And in the majority of cases, by the end of that consultation, we'll have a very good idea of what the problem is. Most of the time, we will get further tests to confirm that, and that's normally an X-ray or an MRI scan. And then once we have all the information, we can set up a definitive treatment pathway to help them get better. So although I'm a surgeon, it's very important to know that most of the patients I see can be treated without an operation, and that's often a combination of seeing a therapist or changing their activity or lifestyle, and maybe some injections in the knee. There are, however, some very clear-cut cases where people do very well from surgery, and that can be the younger patient with a torn cartilage, and we can try and repair that and get them back to sporting activity. Or the other end of the scale, older people who've got a very arthritic knee and have got a poor quality of life, and they can do very well with a knee replacement. And then of course there are a whole range of conditions in between which we can make people better. So whilst I'm a specialist knee surgeon, within knee surgery, one of my specialist interests is knee injuries and sporting injuries. So I treat a lot of patients who've torn their meniscus cartilage, this is a very common injury, and generally in younger people the preference is to try and repair that by a small keyhole operation to restore function of the cartilage and get them back to sporting activities. But the older people get, the less likely they'll need surgery, and often they can be treated without an operation. The other common injury I see is tears to ligaments in their knee, and this is very common when people play football or go skiing or other sports such as basketball or rugby. And for this injury, if people want to go back to playing sports, very often, but not always, they may require surgery, and that will be in the form of a surgical reconstruction. And that again is a very good operation, but not a quick fix. It often takes a year for them to get back to playing the sports they enjoy. If you are experiencing any of these problems of pain, stiffness, swelling, you've had an injury, or you're getting instability of your knee, I think it probably is better to see someone sooner rather than later. Many problems are treated easier at an earlier stage rather than leaving them and neglecting them, and they're often more difficult to treat later on.